I don't know, you got the rocks. Keyboards at the same time, that's.
That's it. Conservation Commission is good practice.
There you go.
Should we get rolling? All right. So we'll call the meeting to order. First item on the agenda is public comment. Does anyone have anything that they want to bring up that wasn't on the agenda?
Just more in the form of an announcement, I've prepared remarks for the select board agenda item number 8 tonight, which should be around 7:15. So I'll excuse myself to go over to that. They are considering having the town vote on the bond again for the town hall parking lot, but still without solar canopy engineering. And so I just wanted to lay out for them what that means in terms of meeting the town.
Thank you.
Else?
Are we recording?
We are.
Thank you.
Next we'll move on to the minutes. Did anyone have any comments or revisions that they wanted to discuss?
I made a small spelling, not a spelling, a little grammar change, but nothing substantive.
I did not look at them, so. Trust. Generally excellent note taking.
I read them quickly. I couldn't open them in the editable way. I was having trouble with the word through the office or whatever it is. So I read them in the PDF form and have no suggestions. I can move, we adopt them as.
I'll second that.
Can I make one general comment though? I'm always going on about this, but, and I see that there's a lot of, acronyms that are spelled out, which I so appreciate. But there at least one that is not spelled out, which is the ARCD. So if we can, I'll keep banging this drum, to, always make sure that we're spelling out any, acronyms.
A question, they also refer to us by first name, which feels right to me because we know each other. I didn't know if we should be more formal in our public minutes.
Yeah, it's varied over the years, I would say, but I don't really have a preference. My only concern is sometimes we have people with the same name and it just says John, blah, 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 and you look at the
Yeah.
attendance list and you're not sure who John is. So as long as the list of attendees is at the top, like, I don't really have a problem with the first name.
Hannes and Hannes.
Oh, well,
True, they're spelled
that keeps
differently.
people on their toes, right?
Extra N.
Yeah,
Yeah.
I do usually use the minutes to like refresh if I wasn't there and it feels more like a recap with first names.
Mm.
And so it feels more representative of the meeting, but that's my opinion. I love the first names.
Some places they do it where they say the full name the first time
Yeah.
it appears and then go to either the last name or the first name. I don't really have a preference, but
I don't care. Is my motion still in the tip? Was it seconded?
Have a vote, all in favor of adopting the minutes? Right. Any opposed? Any abstentions?
I will, I wasn't there.
All right, I think they still pass. So great. So now we can move on to the meat of the meeting, the public health and town plan, and welcome.
Thank you.
You get to be the meat of the meeting, how about that?
Wow, my last name is Needham. Needham. How convenient.
You were waiting for that one.
Great, yeah, so I have a few accompanying slides, so I'll just share my screen and then try to also make eye contact with Mickey on the screen as well, but let me see if I can get this shared real quick.
Actually, this weird little lighthouse in the middle of the table.
Yeah.
Yeah.
Great.
Strange.
Yeah. Perfect. So as you all can see, great. So my name is Melissa Needham. I am the Healthy Community Specialist at the Burlington District Office, the Vermont Department of Health. Really excited to be chatting with you all today and excited to have had the opportunity to take a look at the draft chapters so far. Brief overview of what I do. So I work with municipalities across Chittenden County to essentially enhance health and well-being for all within their communities. And that typically looks like collaborating with decision makers and change agents within a community, like planning commissions, parks and recreational departments, citizen advocacy groups, to develop, implement, and assess health-related policies, plans, programs, and projects. Very broad. So what I can do for folks ranges, but essentially my role is to support and to provide resources as a representative of the health department. So in favor of, or just kind of going over the social determinants of health, because I think it's an important thing to level set and make sure everyone's on the same page, but also to kind of give a brief some insight into how we approach public health issues and how the framework that we apply when reviewing municipal plans and policies. But essentially, the social determinants of health, if you're not familiar, are the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. These can be divided into 5 broad categories that you'll see on the screen. Those being education, access, and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. And in short, these factors are essentially the non-medical factors that affect health and well-being that are outside of an individual's control. And so these factors interact and they can shape how the community's health and also an individual's health. We can kind of see on the right-hand side how those show up specifically in Vermont. So as you'll see in the right-hand corner, more than 50% of deaths in Vermont can be attributed to 4 diseases, those being cancer, heart disease and stroke, type 2 diabetes, and lung disease. And those 4 diseases can be tied to just 3 behaviors, those being no physical activity, poor diet, and tobacco use. And it's really easy when looking at this. And I think historically, the responsibility has been placed on the individual, but in reality, there are a lot of conditions outside of the individual's control that kind of produce those health behaviors. So for example, with physical activity, the walkability of a community, the perceived safety of a community when engaging in physical activity can affect whether or not a person engages in physical activity. Similarly, with poor diet, accessibility to nutritious foods, oversaturation of unhealthy food options like fast food options or just convenience stores, which have higher percentage of unhealthy foods or non-nutritious foods. And then similarly with tobacco use, local tobacco and substance use policies can impact tobacco use, stress, community violence. So all of these conditions kind of coalesce and interact and produce a health behavior that produces a disease, which ultimately increases risk of injury, disease, and mortality. So we use those social determinants of health in our work because we focus a lot on the built environment at the Burlington District Office. Simply because, as you can see on the screen, specifically on the right-hand side, our overall health and well-being can be affected by multiple components of our built environment. So specifically, our 40% of our health outcomes can be attributed to social and economic factors like access to healthy workplaces and economic opportunity, access to quality education, access to or community safety and social support within a community. All of those can affect your health. 10% can be attributed to the environment, so the air and water quality, access to safe, stable, and affordable housing, safe and connected transportation. 30% can be attributed to health behaviors, what I mentioned on the previous slide. Those can be affected by the conditions in which people live. So whether or not there's substance use policy, whether or not there's access to substances in public spaces or around youth spaces where they hang out. And like I mentioned before, opportunities to engage in physical activity and access to nutritious foods. And then finally, that last 20% can be attributed to health and social care. So access to healthcare services, quality care, as well as supportive services within the community. So, when taking a look at the 2025 Williston Town Plan draft, I applied the social determinants of health and kind of taking a look at what are the proposed goals, actions, what are the potential effects that those might have on promoting health behaviors, improving health risk, or potentially negatively impacting that among Williston residents, as well as which populations within Williston might have improved health from the plans or policies, and which populations might be at risk of kind of the health negating factors of that result from different plans and policies. So before I get into, we kind of have a greater opportunity to discuss that at length, I also wanted to give some information on ways in which we, as the Department of Health and in my role, can support Williston as well as other municipalities beyond doing these like pretty extensive reviews of town plans. So there's 8 different strategies on the left-hand side. The first being health guidance. This honestly might just be providing health data. You know, we are the health department, so we have a lot of health data. And oftentimes that data can be really helpful to inform decision-making or to just provide an additional layer of why this policy should be implemented. Additionally, it could be providing or delivering presentations on different health topics throughout the community. My predecessor provided or delivered a few presentations to the Parks and Recreation Department, gave health data to our prevention coalitions throughout the different municipalities. So that kind of health guidance varies, but essentially it's a way that we can support by informing decision-making and just providing that more data support. Health consultation is our very brief, quick analysis of a proposal. We provide concise recommendations on how to better integrate health and equity recommendations into the proposal or considerations, but this might look like if you all wanted to develop focus group questions to survey the residents in Williston, I could take a look at the focus group questions, see if they, or even the methodology for how you're collecting data to see if it promotes equity. Similarly, analyzing program criteria, we can take a look at that and see if it promotes health and equity. Health note, which is essentially what I did in preparation for this, kind of reviewing a comprehensive town plan for health and equity recommendations, but also it could be a summary of existing literature to kind of summarize all of the information related to a health topic. Could be analyzing a proposed amendment to land development regulations, but basically it's a compilation of existing literature data and then also just a summary of the impacts that that might have on health and equity. The health planning matrix is a compilation of evidence-based indicators that we can create to determine the goals of a project, if the goals of a project are being met. So what this looks like is perhaps you are considering creating a community center or a recreation center. We can take a look at the research and at the literature and see what what indicators should you use when designing the space? We can survey residents and figure out what sorts of accessibility features might they need. What sorts of other features might make them feel welcomed or like they belong in that space to improve engagement. The observational audit you might be familiar with if you have heard of or participated in a walkability audit or a bikeability audit. We can lead those or support. But essentially, we assess an existing resource to see what sorts of redesign recommendations or things could be implemented to improve health and equity. And then finally getting down to the more extensive analyses that we can provide or levels of support. We have a health lens analysis. It's essentially a qualitative assessment. So surveying residents or whomever to identify whether or not a proposed policy plan, project, or program might have different effects on subgroups of like subpopulations, to see if there's inequities existing, or that might result from the implementation of your proposal. And then finally, a health impact analysis is a pretty significant systematic evaluation of the health and equity impacts of a proposed policy plan, project, or program. So we can use existing data that we have at the health department or just identify existing data, or we can do a comprehensive health impact analysis where we're collecting data, analyzing it, and then putting together a report. So just some applications based on what I read through the draft town plan. These are just brainstorm suggestions, or I guess like applicable uses, but we could conduct a walk audit to evaluate the safety and accessibility of a pedestrian path from affordable housing development to the nearest green space to see whether or not it's truly accessible beyond the physical features, but how welcoming it is, what sorts of services are available along the way. We could conduct an observational audit of a local playground to assess accessibility features, climate resilience. Same thing with school playgrounds is something we've been taking a look at with rising temperatures. Similarly, kind of what I mentioned earlier, developing a health planning matrix to identify key design features and programming for a community center to promote inclusivity and improve engagement. But before we kind of go into the meat of this section, I wanted to open up time, an opportunity to kind of ask any questions or points of clarity that I can provide.
Just a question out of curiosity more than anything else. When I look at the list of things you just went through, thank you for that. Do you do any of those just as a matter of course, or are they all kind of on demand? That's
a good question. Yeah, I mean, when it depends. So obviously if someone comes to us and requests, we are happy to support however we can. For health notes, we might take a look at a proposal that has not been given to us. Maybe that's at a select board or city council meeting ahead of time, provide our feedback, submit it, or present at the meeting. We also might just provide health data. It's like, I noticed this was happening within your community. Here's what the health data says, just as a consideration for moving forward. But yeah, it's a good question. It's a mix.
Okay, good. It occurs to me that sort of at the population health level, obviously you're accumulating massive amounts of data that can be parsed in 100 different ways to come up with, insights that we might be looking for. That was really helpful. Thank you.
Yeah,
appreciate that.
Definitely.
Question, so you identified the three behaviors that underlie, 3 or 4, I forget, underlie the main problem or health challenges, right, in Vermont. And I'm just curious, like, looking through these examples,
Mhm.
how would those align with
Mm,
smoking or tobacco use more broadly, or diet and lack of physical activity? Lack of physical activity is very obvious.
right,
The other ones are a little less so. And I'm curious, like,
yeah,
where I'm seeing a lot of physical activity
Mhm.
or open space, you know, kind
Mhm.
of access to green space kinds of stuff.
right,
And I'm curious about places or ways in which the other main behavioral issues pop up in this type of example, not necessarily, you know, specifically something you saw in Williston, but
Mhm.
even more broadly.
yeah, that's a great question. So let's say tobacco use. An observational audit could be going around to the different tobacco retailers, gas stations, wherever anyone can purchase tobacco. Taking a look at, are there youth-oriented spaces or places where youth can gather? What sorts of marketing or advertising material are available or visible when kids are coming from school or when they're out in the community, maybe they're at the movie theater and so kind of just taking a look at what is visible, what is being advertised, whether it's explicit or kind of more implicit. So that's with tobacco use. We could also take a look at tobacco use policy. And I think one of the examples that I noted in the, I think this housing chapter was identifying whether or not there are smoke-free policies within multi-unit housing, and affordable housing, considering that you have families living in closer proximity, smoke, whether that's from combustible cigarettes or from vape, other forms of tobacco, ingestion or smoke ingestion could go through the walls, could go through HVAC. So we could take a look at, whether or not there are policies that exist, whether or not those policies are restorative. So, it could be a matter that there is a smoke-free policy. And if a person, if they're found smoking or if there's an issue, they are evicted. And so that doesn't really promote equity because they're already living in affordable housing. They're already at risk of, or already maybe identified as low income. And so now that's an equity issue because they're unhoused. And then similarly with food, it could be, another observational audit, taking a look at, community, what sorts of foods are available, going into a convenience store, seeing what sorts of food are available. It's especially helpful in rural communities where convenience stores and like dollar stores kind of reign supreme because there isn't a lot of supermarkets or fresh food available. So typically in those stores, there's more low nutrient foods, high fat, high sodium. So we can take a look at that. But also, I mean, with like a health impact analysis, we could take a look at, let's see, whether or not plans to, or the health lens analysis, whether or not, kind of what I mentioned previously, if you were to implement local policies related to tobacco use or diet, how that might have disparate impacts on different populations.
Yeah, thank you.
Yeah. Great. So, kind of wanted to, I know this is supposed to be more of like a conversation. I have slides kind of with summarizing my feedback or just what I found. But I just wanted to start off by also, so we can kind of go in the order or how you all want to approach this. But I did want to start off by just saying that from what I read, you all have done an excellent job of thoroughly linking the plans and the policies, the proposed actions and goals to health. There's a lot of fantastic stuff in there. And you can even see by the chapters of specifically like social infrastructure and the attention to reducing social isolation, considering it's a pretty significant predictor of chronic disease and mortality. But yeah, I mean, in just looking through the chapters, I was really impressed. So I just wanted to start off by saying that,
Thank you.
but yeah.
We did, one of your colleagues, or predecessor had
Mhm.
come several years ago.
Mhm.
And it was a real eye opener, I think, for everyone. I may be the only one who was there at that time, yeah, and so it really did make a lasting impact. I think we have taken on board a lot of those things.
Right.
And, you know, they do already align with a lot of our town
Oh, yeah.
plan goals.
Mhm.
But it's a matter of kind of making it more explicit and linking it very specifically to health issues, so
Mhm.
that initial kind of read through a previous plan was super helpful. And so, yeah, so I'm glad that there's, you know, that you're doing the right thing, right? Like we're
Yeah.
catching on and but of course there's always more, so
Yeah,
we
yeah.
appreciate that.
And that's on, and then I'm sure it's reflected in what y'all saw comments wise, but a lot of my comments related to making that direct connection between health and social infrastructure or health and recreation and parks. So that's at the front of folks' minds. And also just considerations for improving equity and specifically health equity to some of the proposed goals and actions, but yeah, I'll leave it up to you all. If it would be easier for me to just go through presenting chapter by chapter, or if you want us to do more of a dialogue.
A blend of the two probably be just fine.
Great. Do you have a chapter you'd like to start off with, or?
Whatever you have first.
Yeah, great.
Take it easy.
Cool. Well, I just put it in this order. So the first one would be social infrastructure and the arts. So yeah, this chapter was really impressive. You know, I've read through quite a few of the town plans and comprehensive plans and haven't seen much related to improving social infrastructure, especially building connection, through arts engagement. So really my edits with this one, obviously putting in that health connection. So making, you know, as I said previously, loneliness and social isolation is comparable really to tobacco use at this point for predicting chronic disease.
Wow.
Yeah, so improving social isolation, and that's kind of reflected in the US Surgeon General's statement about social infrastructure, and that it's crucial for improving health and equity. So even having that as a chapter is fantastic. And so the only things as far as considerations for that one was directly connecting, putting in that health consideration or the health connection, as well as considering some pro-connection policies, which is already listed in the other chapters, things like accessible public transportation, creating third spaces. So that's there, but I think just having that explicitly laid out in the social infrastructure chapter could be powerful. As well as just a few things related to third spaces, is designing those spaces for vulnerable populations. With third spaces, there can still be some barriers to entry. I know that cost was mentioned in the chapter, but it could be things like the location of those spaces, whether or not it's accessible through public or active transportation. If there are policies that might prevent use or encourage, or I guess, discrimination. So taking a look at loitering, anti-loitering policies that might be discriminatory, or other sorts of policies that kind of might discriminate against vulnerable populations. Accessibility features beyond, you know, physical accessibility, but also some of the more like social accessibility, and kind of relating that to creating welcoming and inclusive spaces, which you can do that through art, which is why this chapter is so great. And then also year-round access, considering winter is a long time here. I've noticed since I've been talking to people. I just moved here 3 months ago, so I've been chatting up folks about what winter's like. So I know that winter is a huge challenge in keeping engagement up and social connection. And then also, you know, a consideration might be using art as a strategy for traffic calming and also for building social connection. So those sorts of community art opportunities, and kind of using that as a strategy for placemaking or for building community. So those were my thoughts. What are your thoughts? If any.
I was like, who's on this is the red team? Who's?
Mickey and I are on
Okay.
that one, yeah. The search and general quote is great, and if you have like an actual citation, I would love to just plug that in.
Yeah, definitely. Yeah, of course.
Yeah, I think this is very much along the lines that we're intending here.
Yeah.
I think, you know, now seeing this as someone else has interpreted it, I'm realizing that we may want to come out quite explicitly to try to foster intergenerational spaces, because, you know, some of our vulnerable populations are actually the elderly. And that's where isolation and loneliness is especially impactful. And so the intergenerational spaces would be a really positive way to kind of build that, not kind of warehousing, you know, the older folks over there and warehousing the preschoolers over there, and you know, the working people are all just too busy to do anything anyway, you know, like that's a really unfortunate consequence of a lot of the way our kind of busy lives unfold. And to me, a lot of the value of third spaces is that you know, there is that intergenerational contact. I think the other thing that we talked about when we were plotting this out, and it's been a while, so I may not remember anything correctly, but is that I remember Emily and I having a conversation within our group about kind of generating and maintaining spaces that have lots of potential uses and lots of very potential spontaneous uses. That, you know, it's not about necessarily, maybe programming is part of it, but they also spontaneously you run into someone at the, you know, checkout desk at the library, right? And you end up chatting with them, exchanging emails, and, you know, arranging some future, you know, outing or whatever. But not, you know, basically creating spaces where there could be lots of different uses. There's kind of flexibility built in that also allows a sort of seasonality to come in, because if it's a place where, you know, you can play in the snow, or it has shade in the summertime. So it's sort of seasonally appropriate outdoor spaces. Just trying to think across a lot of the amazing public spaces that I've been in myself. Like, what are the characteristics? And absolutely the welcoming piece, that, you know, but also intergenerational spaces and flexibility and, you know, places to sit, but also places to kind of be on your own or be in big group, or, you know, all kinds of stuff. So I think those were also kind of in the background when we were talking about this chapter.
Yeah, and I definitely feel like that was reflected, especially, I think that was the chapter where you'd mentioned creating spaces for ages 8 to 80 or something. It was like
Okay.
across the
I remember,
lifespan.
yeah.
but yeah, and obviously, you don't have to create a new space. There's already spaces that have been identified as, where folks come together and congregate naturally. And oftentimes those can have those sort of accessibility features like shade, like openness, where multiple spontaneous activities can occur. So, yeah, I love this chapter, it's great. And is there anything that I can provide as like a person representing the health department, or whether that's data or?
Well, I'm just thinking, like, kind of going down the road of, or rather down the route of thinking about shade, like that has become increasingly important with
Right,
hotter summers and, and with climate change.
yeah,
And so, in addition to intergenerational and, all these other kinds of characteristics, having some forethought to, the effects of climate change and how do you balance that need for physical activity with the fact that it's 90 degrees and really humid,
Right.
and that can actually be more challenging, especially if there's also smoke in the air. And it's like, so I think we may want to incorporate some climate related health impacts
Definitely.
that maybe your department is more savvy with forecasting, identifying those kinds of things.
Yeah, certainly. I can't remember which chapter, but I did put some information on the effects of climate change and specifically heat on health. Both physical health and also emotional health. Because, those are connected, but also can exacerbate one another. So, I can definitely provide that. And then, further down the line, when you are, connecting it back to the different support tools that we can provide, that might be an opportunity where we can do a health planning matrix for y'all and identify those indicators or accessibility features that facilitate connection and community within third spaces.
That would be great. Thank you.
Yeah.
I wonder if there's data available from places, I'm thinking about Phoenix, for example, or Houston, where either high humidity or high heat has already been a reality for those places for a long time without climate change, that we could, get our hands on in the way of best practices. How do you shade a playground? How do you shade public spaces? How do you put up misters, for example, if we're here because of humidity, but that kind of thing.
Yeah, definitely. And I know even within, we're actually as a department, and honestly across the state, we're kind of taking a look at the impacts of climate change on students. Because there's lasting effects of exposure to heat, both on physical health, emotional health, academic achievement, and then the lifetime effects of exposure to that. But creating spaces where kids can get some sort of relief from heat and still be outside, physically active, engaging with community. So we actually just identified a kind of an audit of playground spaces or school spaces that can be adapted to parks, green space. If that was something that you'd want to take a look at, kind of those sorts of features. And then, so yeah, I can share that with you if that's something of interest to you, and also kind of take a look at what other communities are doing. I'm coming from the South. Summers are awful. And there's not really, I gotta say, there hasn't really been a lot of forethought and intention and planning to create those sorts of outdoor spaces during summertime. It seems like everything's kind of limited to indoors. And so to be able to have that plan before temperatures continue to get higher and higher would be really beneficial, I think, for the town.
Agreed. I would second that. And I would also second what Steve said, and I'll also mention, I've been talking with Todd, who's our public works director, not public works, Parks and Rec director. And they're currently, they just put out an RFP for a long-term, like 10 to 15-year plan for community parks in town. And I think that that would be a really helpful component of that. And I think that our plan will reference that eventually. But I think that definitely should be included as part of that study.
Yeah.
I have a little bit thinking about this barrier to accessibility and all that. Do we typically won't say those things in the town though, right? But it may be more of in the policies or restriction that put in place, right? I know in the past where I see in the colder climate area where they don't let people to loiter around to escape from the cold, right? In the public space, in the library or whatsoever, right? That kind of thing I think has happened before, but I don't know whether we have such things. Then we should be a little bit mindful about how we're going to accommodate people, right? If you are homeless or whatsoever, right? Those are the things that I think we need to be a bit more mindful about it. I don't think it will be in the town plan. I think it might be somewhere else in the town where you are restricting some kind of access, right? If there is something that open 24/7, are you going to restrict certain type of people from coming in, that kind of stuff, right?
Yeah.
So that's something we need to be a bit more mindful. Yeah.
Yeah. Great. I can move this one. Okay. So then this one, I kind of put conservation areas and recreation and parks, just because these were smaller chapters. But again, great work. My only considerations for this one was obviously making that kind of explicit connection to health, especially in relation to recreation and parks. And those sorts of things might be like how exposure to green space might improve mental health and well-being, aside from the obvious connection to increasing opportunities for physical activity. But also how it can improve social cohesion, the impacts that those sorts of environmental impacts and how that might impact physical health and human health, because those don't always have the direct connection for folks to take a look at. But yeah, beyond that was equitable access to working lands and open spaces. There's a lot of language related to improving access. I think it was specifically related to transportation, but something to consider might be, and I do remember there being a note, but improving access to country parks and more rural parks and beyond active transportation, which is great, but also could be limiting for folks with accessibility issues or challenges. But how can public transportation be used to get people into those spaces? And I listed quite a few just like accessibility recommendations, wayfinding, transportation, the like classic slope and grade of trails to make them more accessible. But then there are also some more specific ones that you'll find in the comment in the conservation areas chapter. Another consideration might be brownfield remediation to both reduce hazards to human health that exist within dense urban spaces, but also to you could create health fields in those locations to promote access to health services or to other vital community services within those spaces. I really loved full disclosure, my background's in food security and agriculture, so love that there was a mention of community agriculture and using parks and open space to promote community agriculture. Something that I put in as a recommendation was, again, using some of those vacant or kind of non-pristine lands that are closer to community centers as places where community gardening can occur, or where you could reduce some of the access issues with young farmers, because unfortunately, like the rest of the United States, the demographics of who owns and produces on land is consistent, so older white men. So how can you improve accessibility to women, to BIPOC populations, to younger farmers, to kind of disperse wealth and disperse opportunity? Kind of going back to what we were talking about with third spaces, using parks and different recreation programming as a way to connect intergenerationally. And so obviously that can be in third spaces, but it could also be through parks programming and recreation programming. And then just a recommendation was mapping connections from green space and open space to residential areas containing larger proportions of vulnerable populations, just to see if, you know, you can provide active transportation, but what does access look like? Can people truly access it? Do they feel like they are safe in those spaces in numerous ways? Yeah, any questions on this one?
I have some comments. My group was the one that did the conservation
Okay.
chapter, and neither of those group members are here. Chapin stepped out, and then Shayla's not here tonight.
Yeah.
I, first of all, really appreciated your comments, and I think that a couple of the perspectives I'll call out were really helpful. And I think some ongoing conversations about those, whether it's just with our group or with everybody here, would be beneficial. To your point about, you made a comment, I don't know if it's up there, about like kind of this idea of conserving like pristine land.
Mhm.
And that is very much what our current ERF policy is we have priority parcels that we've mapped, and they're priority parcels because of certain resources that we've identified on those parcels, and you know, maybe they're forest blocks or something like that. And so our ERF policy is very focused on conserving that sort of place. And this is kind of in tension with that, and maybe focused on conserving land that's closer to our growth center. And that's something that I think our group has been talking about a little bit, but maybe something to really deep consider. And that policy, you know, if we wanted to include it in plan that, you know, addressing that and changing it, could be an important goal. I think too, with your comment about making farmland accessible, broadly, we've had some in our groups some soul searching on, you know, here is farmland that is very important to Vermont's landscape. But also, you know, we talk about flood resilience or erosion and just overall environmental impacts, and it's, you know, maybe not the best use of that land. And so we want to have a goal that's more just keep the rural. And I think that their proposed option of making that land more accessible, not only for people to visit, but to actually use, to be like a community garden or something like that. I think it's a great idea. I think we could see that included in the plan. I don't know, I'd be interested in what other people's thoughts are. I think that's most of what I wanted to say, but once again, thank you.
Yeah, and there's, I know that the practice of conservation has historically been problematic. But I linked some research in there about how to infuse equity and justice into the practice of conservation, specifically related to land trusts. And so a lot of their recommendations within that are to preserve land closer to growth centers and to kind of remediate land that has been vacant or isn't aligned with our traditional views of what land should be conserved. So I think that's something to definitely consider, but overall, in what I've read so far, you all have a fantastic foundation for conservation. So, yeah.
I really like that idea of like conserving non-pristine spaces because they are. I guess I question like, it's like, okay, I live in the ag rural district or ag residential district, and it's like, okay, well, we wanna conserve all this space, but like, who are we conserving it for? Eventually, it just increases housing prices, so only people who can like really afford to get like the rural space, and people who are like, okay, like I want the convenience, or like this is the home that I can afford, whether or not it's I want to live here or I need to live here. It's like, well, they need like, where's like, how is it equitable to say like, yeah, we're gonna condense it all, which has a lot of really good reasons, but it's also just gonna increase prices over here, which limits accessibility if we're not conserving it, but also I like that idea of conserving closer to make spaces that are like intentional, because we cannot always rely on like a developer to develop a space that is intentional in a high density area. And like, what would it look like to not only just say, oh, we have this parcel on priority, if it comes up for sale, we wanna be able to be the first person to reach out. And it's because it's like a green space that people like driving by, but like, what about the one that's in the center of town? Like, obviously those are owned by like, I think like 3 different people own the entirety of Task Corners. So like, it gets harder, but I really like that perspective to think about, what does conservation look like in an area that like, oh, it's not a wooded forest farmland, but what if it's still worth conserving somehow? So I like that perspective a lot.
Yeah,
Great example of that is the stormwater pond right next to what used to be Friendly's, soon to be Big Old Shop. Because that, it's a stormwater retention pond, it's not, and it's all fenced off, right? Like, and yet, I see people walking around it all the time, like for, walking. And there's actually, when we were doing the form-based code work, I felt like I was a broken record, but pointing out again and again that if you stand right where the Chase Bank is now on the sidewalk next to 2A, and look east, you have this actually great view of Mount Mansfield, which is just a little bit next to that pond. And like, that's such an incredible possible resource. And yet it's just very functional, like, there's no access to it, and
It's a great bird habitat.
yeah, right, and it could be such a jewel in the middle of Taft Corners. And it's basically, there's town-owned land, right, adjacent to it, so, it would be, I really like this idea also, and the possibilities are, good. I think that using the ERF funds, or the ERF, funds, for something like that would be really admirable. Hi, Chapin.
And I want the transit center that might be on the other side of that pond
Yeah,
to be large and welcoming and have multi-activities and playgrounds, so that it's not a place where homeless people congregate or something, I mean, I feel like having mixed use of the entire population of the area is healthy for everybody.
that's very much in line with what we were talking about while you were out, on third spaces and intergenerational connection and that kind of thing.
yeah, and let me know if I can provide any support again with the conservation areas or recreation parks chapter, or if there's anything, when you're closer to implementing projects or programs that we can provide assistance with. I'll go on to the next one.
Just like a pause, or rewind back to it, if, Andrew, you said that there was like a RFP put out for like the master plan for parks and spaces, and if we also are thinking about like the town plan now and what does conservation look like in these like non-pristine, in this like non-pristine sense, is there like what type of action item should we look at putting into the town plan? Like, is there something we should look at putting into the town plan in this area?
I think the big one that comes up in my mind is on the RFP, and it's, Todd has basically cited that, given our population, the amount of, community space, community parks, not country parks, but community parks isn't what we should have, kind of based on national standards, I think is what he cites.
It's 7
And-
acres per thousand,
I think you got it right, yeah.
7 point something acres per thousand people as a rule of thumb.
And so it's the idea that, I think Todd said if you include country parks in that number, we are close to the number, like the acreage. But if you don't, we're nowhere. And so it's kind of this, as we talk about accessibility, okay, yeah, let's just say community parks, there's a much greater need. And so I think having that goal stated and then referencing Todd's plan that, he's trying to get is, I think would be good, but.
Is there any, sorry, I'm gonna check up your tangent here. Is there anything that we can kind of plant in that process, the Parks and Rec process? Along those lines?
I think you could try, yeah. Todd might be open to sitting down with the planning commission. Chapin and I talked to him, and I think that process is very much in early stages.
Okay.
The RFP went out, but
He wasn't enthusiastic about us attending a rec committee meeting, but I contacted Danielle Doucette, who was vice chair, I was chair, and has been on it forever. And we're gonna get together and sort of, because I wanted to help with this chapter, actually, it's not, it is this chapter.
The previous one.
Oh, okay, Parks and Rec. Yeah. Wanted to make sure we included the ideas that are currently on the table. And I'm sure you said when their study comes in, we may want to revise that chapter.
right, maybe Melissa, connecting you with Todd would be a great step too. And if you have other ideas on what, you want to review, I'm happy to share that RFP. If you have other ideas, we can talk to Todd.
Yeah. I would appreciate the chance to learn more about what the vision is and also to give our input.
Yeah.
And, we also have like form-based code kind of floating out there over the growth center. And so, thinking through how that would potentially impact, hopefully in a supportive way, the ways that open space, green space, park space get developed in the growth center, which is obviously the place of the highest need because there's the least park space now and the most population, so.
Agreed.
Great.
All right, so moving on to transportation and mobility. Again, with this one, considerations include adding a health connection, so just a few benefits listed up there. Are obviously safe, convenient physical activity opportunities, but also a connected and intentionally designed transportation, active transportation pathway that connects to public transportation, enhances access to essential services, which can improve equity for folks that maybe don't have reliable or accessible transportation. Aside from minimizing exposure to pollution and reducing injuries, it also supports mobility independence across the lifespan. So, we typically think of non-drivers or folks who aren't driving as people who have, it's unsafe for them to drive, but it could also be children, youth who can't drive, rely on other forms of transportation to access services. But also, mobility changes throughout life. You might have a broken leg and you can't drive. And so having access, even if it's temporarily, to alternative modes of transportation is really crucial. I think, again, transportation chapter is great. The only things that I noted were, obviously the health connection, but also assessing access of existing transportation among vulnerable populations, so whether it's affordable, available, and connected to services. I know that their connection to active transportation and just connectivity in general was a big priority from what I was reading in the transportation chapter. So just making sure that those are considered whenever there's new plans or policies that are created. Additionally, you don't always have to create new transportation routes. Sometimes developing along existing transportation routes is more affordable and also just more accessible for folks who might rely on those transportation routes already. One thing I noted was first and last mile transit. So for folks that might use public transportation, how far do they have to walk to the bus stop? Are the sidewalks in good enough condition to be able to walk to the bus stop? How many, same thing with bikes. And then also, since there's a push for bike and pedestrian pathways, assessing barriers, motivators, and equity challenges among cyclists and pedestrians, but also people who aren't using that infrastructure could be really informative and kind of promote equity and inclusivity within that infrastructure that you're planning on putting a lot of resources into. Yeah, any questions on comments on transportation?
I haven't reread that, the work that group's done recently, but, the last mile is a lot identified, and equity is a lot identified by us in general as being a programmatic thing. If we had microtransit, on-demand service that connected to the fixed route service, then we would have solved that first last mile problem for most people.
Yeah, and I noticed that there was a goal for improving microtransit. I do know, and I did comment in there that V-Trans has a grant available. I think the deadline is September or something for
They're
improving.
prioritizing more rural areas. That's my understanding.
Okay,
But there is money coming to Williston too. I
okay.
can't remember what it is.
Great.
I'm sorry, I'm an alternate for the Green Mountain Transit Board too.
Ah,
I can't
okay.
remember where I heard. But Williston, through Melinda, we're looking at getting the grant that I think you're talking about. And we were told, no, it's going to a more rural community. I think St. Albans was the first choice. So maybe, but from your face, maybe I'm talking about a different grant.
Okay,
Yeah,
I can't remember the name of the
So,
grant, but it's
but-
linked in the document with,
Okay,
you can go to the
but there's
webpage.
definitely money for exploring microtransit in all areas, so.
I think it's like we're at the point where we're such a car dependent town that talking about first and last mile, it's like, but like also all the middle miles too. And like, how do we, when we think about putting in, like, one of the things that we've heard a lot in the outreach and process was like a village to Task Corners path. We need a village to Task Corners path, like that came up a lot in outreach, and like, what are things, like, what are equity considerations that we would make in something like what are equity considerations we'd make in a project like that? For like, say like a connector path, like this
Yeah.
is for bicycle pedestrian infrastructure, and like, it is active transportation. It's like, yeah, I don't know my whole point, but like, it feels like we're so bare bones that we're like walking has to be good, like walking has to be an acceptable form, but are there, like, what am I missing there also? Like, are there other like what barriers, motivators, equity challenges, like that fourth, like the second to last point you have, like, would we wanna think about what if we're like tackling this like village to task corner to path?
Yeah, I mean, I could list off barriers, motivators, and equity challenges, but I think the crucial part here is assessing it within the community. So, the challenges in a community that's been researched, you have a report detailing the barriers might be different than it is in Williston, but, so I think having an evaluation of what those barriers might be and engaging folks that aren't typically walking and biking and, what's motivating them not to bike and walk, what sort of challenges, but I think, yeah, and I'm hesitant to.
And the first and last mile is a current phrase. It
Yeah.
doesn't mean exactly a mile. It means somebody
That
who lives
took
anywhere in
something.
Williston, and we have public transit in Williston, but what if you can't get from your house to the closest bus stop? So
And
it's-
I see that a lot, cause I live off south of 89 on 2A, and since the parking lot got put in, there are people who actually walk on the path now, and I use that path sometimes that goes onto the highway, but there are a lot of people who walk into town, like there's someone who walks to Best Buy from the thing, like very regularly. And so you're like, that's like kind of not like, kind of fun, it's like, oh, what if there's bike share? What if there's, what if there was like something else? It's like that sense of thing, like, hey, we put a parking ride so that the bus could go here and cars could go here, but like, what happened? How do you get to where you wanna go?
Yeah, I think that definitely going directly to the source would be a great way to figure out what those barriers and motivators might be. It sounds like there are folks using walking paths, but who are those people? Why are they using those paths? Yeah. And that's obvious, that's definitely something that we can support with, like, we could create and survey residents to identify those barriers and motivators. We could conduct focus groups, we can review the literature and try to find a town that is similar to Williston in demographics or location, and see what's worked for them. If, you don't wanna do some comprehensive data collection and analysis and just kind of see what else is out there, but that's definitely something that we can support with as well.
Cool.
Great. I wanna be mindful of time. So education, not that mindful. Education and childcare, this is a great section. I think within this section, again, connection to health would be great to see. So specifically how investing in high quality education and childcare closes those social, economic, and health outcome disparities. So how academic attainment makes a person ready for working, and how, that affects their economic vitality, their wealth generation, and how those sorts of impacts impact health and healthcare access, but also, including information on how the strength and stability of an economy affects health. That's something that you could include, as well as how education and childcare increases civic engagement. So I've listed in the comments some research and direct connections between education and childcare and those bolded items, just to make it a little easier. Other considerations are kind of what we were talking about previously, is evaluating the climate and heat resilience in schools, but also where kids spend the rest of their time when they're not at school or at home. So our childcare centers resilient to climate change, our after school and summer programs set up well to handle or manage heat. Additional things were, I know that there are buffer zones around educational facilities, but also considering how, kind of like how I mentioned previously, with with tobacco use, how exposure can happen in other areas that kids congregate in. And whether or not those buffer zones that exist are sufficient in shielding kids from exposure to advertisement, marketing, and also just, secondhand exposure from being outside of tobacco retailers or places where folks are utilizing substances. Another thing would be accessibility of playgrounds, something also to consider going back to recreation and parks. There is a park in Chittenden County that was constructed to be inclusive and accessible. However, it's not shaded. So that's just a consideration, is you can create an accessible playground, but also like what are the other built features that might impact use and accessibility. So with that example, if there's no shade, they might get injured if they're touching metal or rubber. They're less likely to play because it's hot. Yeah, so something to consider. And then also relating childcare centers. I really loved the childcare centers portion of this chapter. It was awesome. It was great to see what y'all are planning on studying the feasibility of. But something that I added in was just considering incentivizing development of childcare facilities within or near housing centers. And also perhaps along existing transportation routes, since those are used by folks who are not drivers, or folks that might have transportation challenges. Yeah. Any thoughts, questions?
So like Andrew, my other two team members are on other missions tonight, so I'm a lone voice here. I just want to say that particularly regarding childcare, all your comments were great. Those were particularly helpful because that's one area where we're kind of spinning our wheels a little bit, just trying to find information.
Yeah.
It's just, traditional schools are easy. I mean, that data is readily available. Childcare, because it comes in various forms and they're not always as public as others, it's hard to get the data. So that was really, really helpful. Thank you.
Good, yeah, and I mean, in looking at the existing bylaws or what you all already have in place, it seems like you've already incentivized development of childcare centers in the way that residential childcare centers are set up and that they're able to be accessed or used within those spaces. So that was really encouraging. I think there's already a good structure that you have, but definitely considering other models. Happy to pull more information on other towns or cities that have more innovative approaches to childcare, if that's something of interest.
Yes.
Great. Yeah, I can do that. And then, I mean, going back on some of the other considerations that I put on here, if there's anything that we can support with, if that's maybe assessing accessibility within playgrounds or those sorts of spaces, taking a look at how sufficient buffer zones are in shielding exposure to substances. Those sorts of things we can definitely assist with.
Cool.
I have one other thought on this, which actually has a lot of ripple effects, which is school busing. And I think that, and we all notice a huge difference when in like traffic, when school's back in session. I live right near WCS, so I see a lot of that traffic and, and school buses are, safe and statistically way safer than individual parents driving their children. I have in the past done some research on busing. I know that there is finally a nascent walk to school program in Williston, which is great. But I would love to see some, either if you know of any data or can dig some up. I feel like it would be a really important message to essentially point out the benefits of school busing
Mhm.
rather than individual driving.
Right,
Obviously, there's air quality impacts. Obviously, there's also injury and crash impacts.
Mhm.
But then, what is it, one of the things I've always grappled with is, okay, what is it that makes people not want to put their child on the bus,
Mhm.
even though it's safer and more efficient and more ecologically sound and all those things, right? What could be additional incentives for improving the rates of school bus ridership? I don't know.
Yeah.
But it seems like, I don't know, I've even thought about the buses themselves, like, are they air conditioned? Do they have, like, for especially the high schoolers, do they have Wi-Fi on them? Especially in, spots around town that we have very poor
Mhm.
cell service. Just kind of, and I realize that some of it is kind of a stretch to health, but maybe
Everything's
it's
public
enough.
health.
Exactly. So anyway, so I want to kind of throw that out there, and also to you, Steve, as one of the chapter authors, maybe we can think about some phrasing or just pointing out some data or something like that to try to, encourage that.
Are you connected with Amy Brewer, who has been leading the walk and ride to school program, and the administrators support it strongly, and it's being very popular. It's gotten very popular the last couple of years.
It's wonderful to see. Just makes my morning when I see the Caterpillar going down the street.
I've worried about
But
this.
I would be very curious how much it's actually cut down on how many kids are driven to
Right,
school.
Right.
Like, are they normally the kids who would ride the school bus?
Well, and maybe only in good weather and blah, blah.
Right, and that's
on on.
fine, but.
This bothered me for a long time about, since I had kids in school and then I have grandkids in school. That, I was wondering, because some parents, especially younger kids, worry about safety and bullying. I was wondering, how you can have crossing guards for roads, well, we don't, but other, like Essex Junction has volunteer crossing guards. And I say volunteer, but you have to be, background checked, and I think there may be a very small stipend. But could we have that like a bus parent, like a den mother, or den father for the bus?
Some places do have bus aides.
Yeah, who just helps kids who are maybe having trouble getting on and off, but is there.
Yeah.
So that the bus driver isn't trying to manage behaviors. And so that parents feel more relaxed about having their kid on the bus.
State law, Rhode Island.
That you have to have another adult on the bus.
Oh, wow.
Interesting.
See, there you go.
And just a footnote, Greg Marini told me the other day, we're getting 6 electric buses. We've had 2 electric buses. And he said, we're getting 6 now, but I don't mean, does that mean we're getting 4 more? Are we getting 6 more? But, then that statewide grant that was recently come through from the infrastructure bill, we're getting, significantly more in terms of air quality,
Yeah.
for the kids especially, but also for the.
That's awesome. All right, I'll try and go through these last 2 slides pretty quickly, which is unfortunate because I feel like the homes and growth chapter was the most feedback. Again, the homes and smart growth chapter, great. A few considerations, and it's kind of tied to other chapters that I mentioned previously. But having that health connection in there, specifically how housing, and this is all written in the comment section in the chapters, but how housing improves financial security and healthcare access and use, engagement, how housing improves participation in health promoting activities, as well as ability to age in place, because I know that that's concern, especially in Williston, is aging in place. But having a health connection is definitely a consideration. A few other suggestions that I put in there was, again, incentivizing development, like with childcare centers, of affordable housing along or near active and public transportation routes. There's having those intentionally planned spaces where folks that would benefit from affordable housing can also have use of public transportation without having to consider first or last mile transit, or how they're going to get to a bus stop, or what other services they might need to access. In taking a look at, and I did link it in there, there's some information on specifically in mixed income housing, some discrimination and bias concerns that non-market rate residents experience. So recommendations within that report are to create spaces outside of housing where folks can build community. And to also provide, I think it's listed in there. Nope, it isn't. Also providing some policy enforcement or just added support that encourages landlords, building owners to respond to unit concerns or challenges in an equitable way, because that's also something that's raised, is folks that are in a subsidized housing unit often or may not have the same access to quick response to maybe there's mold, or maybe there's plumbing issue as a person who's paying market rate. Something else was incentivizing visitable design to facilitate connection and promote aging in place. So considering how new development happens, what's the residential design looks like, so that folks can both continue to age in place, but also allow for individuals who might have a mobility impairment to be able to visit their family or their friends versus folks having to come to them. Again, like I mentioned previously, those smoke-free policies and multi-unit housing, and making sure that those are sound and also restorative. Similar to this education chapter, but limiting those health negating businesses near affordable housing. Assessing whether or not, like if there's a vape shop, is it in or near, or are there multiple retailers that are selling tobacco, cannabis, and alcohol concentrated in those areas? Often that is the case. So just assessing that and making sure that those businesses are not being concentrated near affordable housing or near populations that are low income. Another consideration is housing habitability. There's a lot of comments related to that within the draft, or within this chapter draft. But some recommendations for improving housing habitability is providing rehabilitation or mediation funds to landlords and homeowners to improve housing conditions and accessibility, because I mean, that can include things like exposure to mold, but it could also be air conditioning. And so providing funds and support so that people can have those features within their homes. And then finally, having pre-evacuation and flood mitigation plans that prioritize at-risk populations. Those are often the folks that are living in spaces that have the highest exposure to negative effects from flooding or other climate-related issues, but also have the hardest time responding or moving on from the damage that occurs. So just having those sorts of plans and being really intentional about not only design, but also how are you addressing those people first, and making sure that they have the support that they need beyond the first initial weeks or months that a flood occurs. I'll go ahead and just go to the final one. 3 things additionally, I did review your hazard mitigation chapter. I can send, or I guess just request access to add comments, just because this is something that I've been noticing in the 3 months that I've been here, is there's not always an infusion of equity into emergency preparedness. So something like communicating risk, or communicating that there has been a natural disaster, like how accessible is communication? And there's some information in my edits on green stormwater infrastructure and making sure that those are installed equitably. I know that there was mention previously of green stormwater infrastructure in certain parts of the city, but making sure that those are available in a place like Taft Corners, so that folks can not only have the added benefit of reducing stormwater, but also just the green space and the other services. And the two other ones are, I encourage you to take a look at the community health needs assessment. There's a lot of fantastic health related information in there. Namely, I'll point out a few. You already have points related to food access and food security, housing, and social connectedness. But something to also consider is how our residential areas, commercial developments, these like really crucial community institutions connected to healthcare. So can people access a primary care clinic, a dental clinic, mental health services through public transportation or active transportation? You could argue the same thing with like telehealth. Do folks have broadband access, technology access, and how the town of Williston could facilitate folks getting access to healthcare services?
I would just comment on that and say that we had a very recent, was this week, example of a question about this. It was a PT in the industrial zoning district who couldn't go in there because we don't allow that. And we had some discussion in the office about, hey, this is on Williston Road, there's a bus here. Maybe that's something to consider for the future.
Yeah, and an urgent care. It was going to be like an urgent care and a PT like specifically for industrial workers.
Yeah, or, you know,
PT 360 is in the White Cap.
They are.
Industrial.
Yes.
Yeah.
Is that just right? How is that managed?
Slightly different. It has a special business incubator
Okay.
status, and then it also was originally an accessory use. Now it's pushing that, I'd say, but they're there. So that's good.
Yeah, it's great that those conversations are happening. And then the other priorities that were identified in that community health needs assessment was mental health and well-being, specifically among youth. So how are you planning for mental health and well-being? What sorts of policies and plans and programs can you implement that address mental health and well-being? And there are some suggestions in the edits as well that I'll send. And then finally, love that, I can't remember which chapter it is, but there's a commitment to apply an equity lens analysis to everything that you do. Love it. Let me know if we have quite a few tools at our disposal, so I'm happy to share that with you. But yeah, that was the first thing I noticed.
We're trying to do it in every
amazing.
chapter.
Yeah.
Yeah.
And it shows, I mean, just with the way, at the beginning of each chapter, between the introduction
Yeah.
and having the equity, livability and resilience, right?
Exactly.
Yeah, love it. But yeah, sorry to go over, but.
This was really helpful.
Okay.
And this one in particular, this was kind of a blind spot for us. I realized when I saw your comments that, looking at hazard mitigation, I'm not thinking about healthcare. I'm not thinking about access to mental health, and that, we're thinking about don't get struck by lightning, don't get hit by a falling tree. Those are hazards, right?
Yeah.
But this clearly falls right in the middle of that, and we didn't speak to it. This is good. Thank you.
Yeah,
Very
definitely,
helpful.
definitely. Well, let me know if there's any other, aside from what was brought up today, with certain things that I can look into. But if there's any of those 8, let's see if I can find it. 8 ways in which the health department can provide support. If there's anything that sticks out or you might want to talk further about, we can definitely explore that.
Selfish question. Will we have access to any of these slides?
I can send them to you. Okay. I can write up, like a more in-depth summary of the points that I brought up, if that helps too, and just send it.
It would be helpful. I don't know if it would be necessary. I don't want to put you out at this point, but like the first few slides where you had the major categories and that kind of thing, those, for me anyway, those would be really great. Aha, I forgot about that part, you know,
Yeah,
Yeah, I did transcribe a lot of what you said.
Fantastic.
So if you want to look at the minutes once they're written up and then like you could add to that,
okay.
maybe that would be
Yeah.
less work.
Great.
Yeah, I would love to see the slides too, just, I think again, to kind of refresh our memory, it's easier than digging through, finding the recording
Yeah.
from, 4 months ago or whatever it was. And I know that we want to take action
Yeah.
that you recommended, and go back and make sure that we're making those health connections in particular. And the slides are super helpful, so
Yeah,
I would love to have access to them.
definitely. Yeah,
Melissa, if you share those with staff, with me.
Yeah,
and
then they
we will-
can
Yeah.
take care of it.
sure.
Yeah.
Yeah, I will plan on sharing that with you tomorrow,
Thank you.
but
so where in the South are you coming up from to experience our inconsequential and mild winters?
North Carolina.
Oh.
So it's not like
East or west? I mean, the mountains are in the, oh, okay.
I went to school in Boone, North Carolina, but I grew up in Raleigh. And I moved up from Fayetteville, which is like southeast. So I've lived in most parts of North Carolina, but
Where the earth is red.
yes.
I have a friend at App State.
Ah, nice.
Is that where you went?
Ear than ears, that's what they said. Anyways, yeah, I'm excited to experience snow.
Really?
Hopefully we'll get some this year.
Probably for the first 2 months and then I'll be,
Come talk to us next June or something.
yeah,
You have to embrace it.
Yeah.
That's right.
yeah, I'll learn to
Yeah.
do
Your
winter
mental health.
sports.
You have to
It's all about
embrace it.
Layering.
Oh Lord. Yeah, I need to get
We
some
don't want
jacket.
to, we don't want to scare you, but snow is totally different experience. Let's see.
That's what I hear. Yeah, I had to get winter tires, so that'll be interesting.
Yeah. You should start taking vitamin D3 now if you don't already.
Oh God. All right. Sounds good. Sounds good.
Yeah.
Thank you for your time.
Yeah.
Thank you so much.
Of course. Yeah. Y'all have a good rest of your evening.
Thank
I'm
you.
just gonna casually put my stuff up here if you wanna continue.
Okay.
All right.
That was great.
Yeah, thank you so much. Next up, we've got the FY24 quarterly reports.
Yeah. Yeah, we can just go over it briefly, but Andrew, do you wanna pull up the pages?
Yeah. The
So
reports or the construction cost.
I guess both. Yeah, so this is something that Matt puts together for, I guess it's like something in a requirement from the town manager's office. But there are some interesting things that relate to the town plan specifically, so
This is the Q4, the
yeah.
most recent one.
So this with permit activity, this has like the 5-year average for construction cost, but the other document has the numbers inflation adjusted, so it's a little bit more accurate.
Zoom out a little bit.
Yeah, it's just like a little bit more dramatic of a graph on the other document. So just, I guess that's a better graph to look at. And then just with the quarterly report numbers on housing units, one thing to note is that the vast majority of both construction costs and units comes from building G of Finney Crossing. It's like what is it?
I think it's 38.
Yeah, 38 of 42 is just from one building. And then I also just took a look at the AP spreadsheet earlier today, in relationship to the annex, and there's only, I think, 6 total units in FY 2024 that are from the annex, so that's going to be a large number in the coming year. But there aren't too many other subdivisions permitted right now that will really increase those numbers.
Yeah, it was a really small number, the first 3 quarters of dwellings, permitted dwellings.
Yeah.
Yeah, I think a note that, I thought was significant too was just how quickly building G was permitted.
Yeah.
Because it's form-based code.
It is, yeah.
Mhm.
And can't remember exactly when that, was stamped and received, but I don't think it was over a year.
Wow.
So,
Mhm.
That's the one that goes next to the hotel, right?
correct. Yeah, and I think they have,
Next
they've been
to-
right there,
What did you call it, Anthony?
building G. That's
Yeah.
that's the Finney Crossing. It's actually the second to last Finney Crossing building that will, yeah. We're almost there. The last
One
residential
more in the
building.
park.
Is G for the green space that it's replacing?
There will be a small little public area, I think between the hotel and the. It's part of the form-based code requirement.
But that's where the access to the underground parking for the hotel is, so.
I think it's either
Maybe
on the
further
end
from-
or it's on the end underneath the Velco easement, or it's between.
So it says, I'm just looking at the like major developments page on the town's website. It said that the building was reviewed in February and then construction is ongoing, right?
Mhm.
Or have they started construction?
It's, yeah, the foundation is there, I think.
Yeah. Mhm.
And that was just an FYI.
It was.
Yeah.
Then the last thing on the agenda is the draft comment letter. Not the solar.
Yep, so this is also a bit of an FYI. The current plan is to finalize this at the next meeting on September 3rd.
Who was drafting it?
So staff drafted most of this and then we went to the Conservation Commission for the impact to the watershed, of the wetlands and watershed protection buffers. The project area is impacting unidentified class 2 wetlands. And so the Conservation Commission drafted some comments. Which I encourage you to review. And if you have comments, if you've reviewed it, we can
I
discuss.
skimmed through it, and what I didn't see was their agreement to put the animal fence upside down so the bigger squares were in the bottom. I didn't see that. And I saw the section about, what is it in there? I did see the section about the fact that it does impact wildlife corridor.
If I remember correctly, the impact assessment that VHB did for the applicant does discuss that. I don't know if there's any like technical information about
In here, there was
the fence.
a reference to that the plans don't create a concern, and I didn't see actual, so that's in that separate document.
The word
It is.
fence does not appear.
Yeah.
In the document.
Right.
Okay.
I was looking for that one in this section.
I think that some of the discussion at the Conservation Commission, someone might have mentioned that it will likely inhibit larger mammal,
Anything bigger than the process.
Right. So that's something to consider.
As I read it quickly, I felt like everything in it was true. And yet it was a little bit uncomfortable when it said there are no concerns from the town about this, or no concerns from the town about that. Because we did have concerns, we're just accepting those as reasonable, given the benefit of generating more solar and the precautions that we're taking. So I didn't know whether did anybody else have a feeling about it?
I didn't, I did catch the fence thing though, and I was curious because it wasn't in there. Didn't know if that was, because we talked about that before.
Yeah.
I had that sense too, but I'm also like admittedly a little like, this is a huge solar installation that they're just gonna use for their own thing. But
We will
we
get
know-
credit though when we're supposed to double our solar generation.
Yeah.
According to our town plan. This will help.
At some point, it seems like we honestly have very limited sway in this. It's kind of like our chance to say, effectively, it's kind of a nice thing to do, right?
Yeah,
Like,
it's just, this is just input to the PUC in case
Yeah.
there's something, a big red flag, right?
yeah,
So, yeah, the recommendations can be adopted as conditions for the permit. It's not dissimilar from how our Conservation Commission makes comments to the DRB. Their main concerns were about, not knowing the impact, the driving the poles for the solar will be on the wetland. And really interested in studying that over a longer period of time. And make sure that that wetland is maintained. And I'm not sure what the PUC's
I've
approach that
thought
would be.
about that. From the perspective that. We want a lot of solar and yet a lot of our lands have class 2 or class 2 wetlands. And we say you can't do solar development within 50 feet. I think, like,
Well,
of the class 2 wetland.
this is going right into a class 2 wetland.
Okay,
So our bylaws don't specifically apply to solar, I don't think, because it is a utility and we can't regulate it.
okay, because I thought that our bylaws basically said you couldn't put, and I know when they put the ones back, the trackers back here, they put them in what was classified as upland soils, although it's a mixture. I just feel like solar is important, and if it doesn't disturb the wetland, it should be allowed. I felt like that. I thought we weren't allowing it. Okay.
So I'd have to refresh myself if there's a specific mention of solar installations, but I know that for any other structure, our bylaws are very simple and
Yeah.
it just says no.
Yep.
I think this letter does a good point in calling out the wetland concern. Good point too.
Including what we don't know, like the impact of driving, posts and supports and so on in, and the, requirement to restore should it be necessary.
When we had that meeting with them, I can't remember in what way this came up, but we had some questions about kind of long-term, like what happens if because it's integrated with Global Foundries, like what happens if Global Foundries, leaves Vermont? And what happens to the solar array? Does it just revert to, the town or?
Buys the land.
Or whoever buys the land, and what if they don't want it there, or kind of that like long-term.
There is something in this about that, right?
So the
PUC requires.
it's a contract between Global Foundries and I'm gonna forget the name of the
Encore
thank you.
Yeah,
Renewables.
It's a 25-year contract
okay,
and there is a plan to remove the solar array after 25 years, if that's what Global requests. There's an opportunity for extension to it, to do maintenance. I'm not sure what the implication would be if they, Global sold the parcel.
Right,
how that would be transferred.
yeah, I guess it seems like it would be something to pass by the town council or something, you know, the legal team, just to see like.
I think Melinda said something about this the last time, and it's like because they're becoming their own, it's something about because they're becoming their own utility, they're regulated by. Like essentially, if they
The
decided to
state,
shut down,
right.
they have they're their own utility, and so
Right.
they're bound by other rules beyond just like the town being like, hey, you now have solar panels,
Right.
what?
Right. I
So
see.
that's, I think, how that was
That
covered.
makes
Okay,
sense.
thank you, that's helpful. Yeah.
Anything else?
I can just report that
Oh, yeah.
the select board listened to this, nicely. I missed, Bruce's presentation of what the bond is for. So then their question was, well, can we add solar later? And of course, within this, I said, I quoted a study that said the cost is high to add solar to an existing parking lot. And, Bruce said, well, we shouldn't get so worried about that, because if we just do the south part, the posts would go along the edge. And everything is now boring, so BORE. So that if we had to add conduit later, it would be bored, you wouldn't be digging up the asphalt. So he actually said, his opinion was you could add it easily. And then the grant that they got has 36 months before it can be executed, and it has been already a while. But at least we got it in May.
4 months.
Yeah, so we have like 30 more months or something to, before you actually have to do the project. And during that time, they could do the engineering on the solar and add the solar. But if it wasn't included in the bond, then where do you get the funds for that investment, even though that investment will pay back in the long run? And so I think not including the solar is problematic, but I think they don't want to hold up the project for its other benefits for the town and no problem. I think that's where it stands, but at least they all now are very aware of the solar aspect.
Thanks for doing that.
Yeah, thank you. My understanding was that horizontal drilling is actually really, really expensive,
Yeah.
but, maybe I'm,
Especially in these soils.
yeah.
We'll see.
Thank you for that, Chapin.
Motion to adjourn.
So moved.
All in favor? Okay.
Well done.
Did they have
Good
any?
night, everyone.
Thank you, Mickey.
Bye, Mickey.
Did they have any conversation around like